A 10-year-old boy presents for a routine follow-up visit. He has no acute complaints, no chronic medical problems, and takes no medications. His growth and development are normal, and BMI is 23. A screening fasting lipid panel shows total cholesterol 205, LDL cholesterol 145, HDL cholesterol 42, and triglycerides 120, all in milligrams per deciliter. Which of the following is the most appropriate next step in evaluation? Option A, apolipoprotein B. Option B, basic metabolic panel. Option C, liver function testing. Option D, hemoglobin A1C. Option E, repeat lipid panel. Take 10 seconds. This child has an abnormal screening fasting lipid panel. Elevated total cholesterol, elevated LDL, low HDL, and elevated triglycerides. He has a normal BMI and no chronic medical problems. What is the single most important next step before ordering any additional tests or starting any treatment? The correct answer is E, repeat lipid panel. When a screening fasting lipid panel is abnormal, the next step is always to repeat it, not to immediately order further workup or start treatment. It is recommended to repeat testing within 2 weeks to 3 months. This is important because transient factors such as recent illness, dietary variation, or laboratory variability can falsely elevate lipid levels. While awaiting repeat testing, counsel the patient about dietary and lifestyle changes beneficial for heart health. Hemoglobin A1C is used to screen for diabetes mellitus, but it is only appropriate in patients who are overweight or obese with additional risk factors such as a positive family history or evidence of insulin resistance. This child has a normal BMI and no risk factors for diabetes. HbA1c is not indicated. Liver function tests are obtained before initiating pharmacologic therapy such as statins, or when evaluating suspected secondary causes of dyslipidemia such as hepatic disease. However, you must first confirm the dyslipidemia before ordering any of these. Apolipoprotein B is not part of the standard initial evaluation of pediatric dyslipidemia. Basic metabolic panel is not indicated for isolated dyslipidemia. Key testing point. When a screening lipid panel is abnormal in a child, the next step is always to repeat the fasting lipid panel within 2 weeks to 3 months. Do not jump to liver function tests, statin therapy, or diabetes screening first. Confirm the dyslipidemia before acting. Transient factors can falsely elevate results. Follow for daily board questions.